Yeah, okay, so here's your endoscope, and drop down the scope. Here's my reflex hammer. I don't need anything else.
Is our patient going to be sitting on one of these exam tables?
Yep.
Okay.
Okay. So you guys, let me just reassure you that I've taught this class for about 5 years, so I know this assessment. It's just that sometimes I'll forget a piece, and then people will use the excuse to, I didn't remember you doing that in the, in the health exam, and so I should get credit. I'm like, no. So I'm just going to reference this just to make sure that that I don't miss anything. Because I'm used to doing nurse practitioner physicals, which are much more complex than this. So, yeah, this is more surface. Okay. Richard, are you sure you want to do it that way? You don't want to do it this way? Are you sure you want to do it this way? Okay. So, hi Patty. I'm Julie. I'm going to be your clinician today doing your examination. So I want you to know if anything hurts you or is uncomfortable, just let me know and we'll change it up. Okay. Can you tell me what brings you here today?
I'm here to pass my physical.
Your physical is, yeah, very good, awesome. So I'd like to get a little bit of information about you, Patty. Can you tell me your name?
Patricia.
Patricia Weatherford. Good. And can you tell me how old you are?
49.
Okay. Are you married or single?
Married.
Okay, great. And do you have any children?
I have one child and a grandchild.
Oh, awesome. And can you tell me, do you live in what type of residence do you live in? Do you live in a home, an apartment, a home? And is it a permanent establishment?
Yes.
Okay, great. Awesome. A couple other things I want to ask you is I want to find out about your allergies. Can you tell me, do you have any medication allergies? No. Great. Do you have any allergies to any type of products such as latex?
No.
And latex allergies. And do you have any seasonal, or do you have any environmental allergies like pollen? Pollen. Okay. How about like pine, anything at all like that?
Not that I know of.
Okay, awesome. Great. Can you tell me what kind of medications that you're currently taking?
Let's say I take a multivitamin.
Okay, great. And just how many of those do you take?
I take one, and I take a hair,
day?
skin, and nail. Yes,
Okay.
one a day, and a hair, skin, and nail supplement too.
And do you know what that's called?
A compounding pharmacy in Virginia.
That's great. Okay. So, Patty, do you take any over-the-counter medicines?
Sometimes I take Tylenol when I have a headache.
How often would that be?
Once every couple months.
Okay, and then when you take it, how much do you take?
Usually I take 3.
3. Okay. And any other supplements or herbals? Like you told me about your hair, joint, and nails. I'm assuming that's a herbal supplement.
Right.
Anything else?
Right now.
Do you eat anything that could be supplemental, like black cohosh or anything?
I drink soy milk.
Soy milk. Okay, great. That's awesome. Wonderful. I'll help you with your estrogen.
Yeah.
Okay, good. Okay. Any chronic conditions? Such as diabetes, rheumatoid arthritis, osteoarthritis. Yeah. And then are you on any current treatment, such as asthma, inhalers, or steroids, anything at all like that?
No, I take estrogen cream and that's it.
Okay, great. How often do you do that?
Once a day.
Once a day. Okay, it's topical?
Yes.
Okay, great. And was that prescribed by a physician?
Yes.
Wonderful. Okay. Now, I want to ask you some other things, Patty. Can you tell me what you've had to eat in the last 24 hours?
Yes, I had oatmeal for breakfast both mornings, sandwich for lunch both mornings, a piece of fruit and a salad, and a protein and a veggie for dinner.
Great.
Both nights.
And how about to drink?
A lot of water.
Okay.
How much coffee?
How much water?
About 6 of those bottles.
Okay, great. And then a couple cups of coffee?
Yeah.
Okay, awesome. I want to ask you a few questions about your gastrointestinal system. It's just some questions just to kind of talk about your health. Can you tell me how often do you have a bowel movement, Patty?
Once a day.
Once a day. And can you tell me what it looks like?
It's brown, well formed.
Okay, good. Do you ever have any nausea or vomiting?
Just occasionally.
Okay, how occasional? Once a week, twice a week, once a month?
Once a month.
Once a month, awesome. Do you ever have any heartburn or water brash where water comes up into your mouth?
No.
Okay, great. Do you ever have any loose stools, diarrhea?
Just occasionally when the baby gives us all the rotavirus.
That's a pain, isn't it?
Yeah.
But no current symptoms?
No.
Okay. Any hemorrhoids? Any problems defecating? Any pain on defecation? No. Okay, great. I'd ask you a couple of questions about your heart. Do you ever have any chest pain?
No.
Okay. Any swelling in your legs?
No.
No. Can you walk up a flight of stairs?
Yes.
Okay, awesome. Without getting out of breath or
Yeah.
short of breath? Great. Do you ever have any racing of your heart or skipping beats of your heart?
The night before exams.
Night before exams, a little bit of palpitations,
Uh-huh.
right? And then how often would you say that occurs?
Every time an exam happens, through that whole day.
Okay, and then
Uh-huh.
would you does it like flutter a little bit and then go away, or?
It pretty much stays around all day.
Okay, ooh, that's terrible. Have you ever seen a cardiologist?
Yes.
Okay, so they've ruled that that was not a problem for you?
I have a small FO between my septum.
Oh, okay, so that could
Atria.
definitely been a problem. Okay, well, I mean, it can still give you some issues with it. Okay, wonderful. So we've just done 2 review of systems, and so we're just gonna move on. So as I do this exam, I'm going to look at Patty's skin when I do all the exams. So I can see, Patty, that you're using sunscreen, you don't have any obvious tan lines, your skin looks good. Can you tell me about your history in the sun?
Lots when I was younger.
And then how about now?
None.
Okay, great. And so do you have routine skin assessments?
Yes, I do.
Okay, awesome. You go to the dermatologist twice a year for your skin evaluation?
Actually, once every 2 years.
Okay, well, the law says that now you can go twice a year, especially if you live in Florida. So we want you to go get
Really?
your skin assessments. Yeah, they have to take you twice a year.
Very interesting.
Yep. Okay, so Patty, I'm just going to look at your head, and again, I'm going to palpate her, which I've palpated her once already. Okay, Patty, I'm going to check your eyes, so if you could take off your glasses for me. I want you to follow my finger. That's on an HMO, dudes. That twice a year, it's on an HMO.
It's good to know.
Okay, now Patty, look way far away for me. I'm going to do accommodation and convergence. Now Patty, look at my finger. Awesome. Great. Now Patty, I'm going to look in your eye, shine a light in your eye. So look straight ahead for me, Patty. I'm doing direct. There's constriction, and then I'm going to do consensual. Great. Now look straight ahead, Patty. There's direct. There's consensual. Awesome. Patty, I'm just going to look one more time into your eye. If you could just look forward for me. Here's my red reflex. Here's my red reflex. Thank you very much, Patty. I'm just going to use this light to kind of look in your ears. You can just lean your head back a little bit for me. Do you have any trouble breathing out of your nose?
Yeah.
Great. I just need to get a tongue blade. I forgot to do that. Grab my tongue blade. It's right here. Be sure please don't get my butt.
So you don't have to actually look in the people?
Well, I did with the red reflex, but I don't have to visualize. I don't have to talk about the veins and macular and Okay, so Patty, can you stick your tongue out for me? And can you say ah? Ah. Awesome. Okay, good. And can you swallow for me? I'm just filling a thyroid there. Okay, Patty, I'm going to give you a little massage on your head. And just relax for me. Sorry, Deez, I have to close my eyes when I do this. It helps my feel. Shrug your shoulders for me. Okay, and again. All right. Can you open and close your jaw for me? Awesome. Side to side. In, out, and in. Good. Thank you, Patty. Okay. Patty, that pretty much takes care of your head. Let me finish your ears. Okay. So, Patty, I'm going to say a spoken word, and I just want you to repeat for me what I've said.
Okay. How now, brown cow? Dogs and cats.
Great. Awesome. And I'm going to look